Hello everyone, my name is Jane Espinoza and my topic for my presentation is autism spectrum disorder. Autism spectrum disorder consists of a range of conditions that affect brain development in children, which leads to challenges with social skills, communication, and being able to handle changes or new situations. Throughout the 1950s and 60s, autism was originally seen as a form of childhood schizophrenia, and people often thought that it was caused by cold parenting. Then in the 80s, it was seen as a set of related developmental disorders. And now it is finally seen as a spectrum condition with wide-ranging degrees of impairment. Some interesting facts are that autism now affects 1 in 36 children. Boys are 4 times more likely to have autism than girls. About 40% of children with autism do not speak, and 25 through 30% of children with autism have words at 12 to 18 months of age and then lose them. Moving on, there are many differences in brain development that contribute to the start of autism, such as accelerated early brain growth, atypical brain connectivity, structural differences, and altered neurochemical signaling. As children with autism grow older, the way their brain connections develop become different from what's seen in children without ASD. Typically, when the brain matures, it prunes and opens up neural pathways. However, people with autism tend to have too many connections in some brain regions. This is known as overconnectivity. Sometimes there are not enough connections in other parts of the brain, known as underconnectivity as well. When there is reduced connectivity between brain regions like the frontal, parietal, and temporal lobes, it can cause impairments in more complex cognitive functions, like social cognition, language, and executive function. On the other hand, when there is overconnectivity in sensory and perceptual parts, for example, then it leads to enhanced perceptual abilities and attention to detail, which is usually seen in people with autism. Studies have found that the brains of people with autism have some differences in their physical structure when compared to the brains of people without autism. The amygdala and hippocampus sometimes are a different size, shape, or organization in people with autism. The amygdala processes emotions and feelings, and the hippocampus is involved in memory and sense of direction. These differences in the brain essentially help explain why people with autism sometimes have a hard time with things like processing emotions, remembering information, and spatial awareness. Brains with ASD also don't have the right balance of important neurotransmitters like serotonin, dopamine, and GABA. The chemical imbalance can affect how the brain develops and functions, which again leads to the social, communication, and behavioral issues linked to ASD. Serotonin is important when it comes to regulating mood and emotions and has been linked with helping carry out cognitive processes such as learning, memory, and decision making. Dopamine is part of the brain's reward and pleasure centers and is important for regulating voluntary movements and muscle coordinations as well. It also is involved with the prefrontal cortex, which is in charge of executive function and complex cognitive abilities. GABA is the main calming neurotransmitter in the brain. It helps to reduce the activity of neurons and prevent them from getting too excited, and it also plays a role in motor function, brain development, and sensory processing. These chemical imbalances can affect how the brain develops and functions and can lead to hypersensitivity or hyposensitivity to sensory stimuli like sound, touch, issues in cognitive functions like learning, memory, attention, social and communication problems too, like repetitive behaviors and limited interest. Now moving on to the evolution of autism across development, ASD is a lifelong condition that impacts people's communication, social interactions, and behavior. During childhood, around ages 0 to 5 years old, early signs show up such as delayed language, trouble socially interacting, making eye contact, doing repetitive behaviors, and challenges in sensory processing. During middle childhood, around 6 to 11 years old, they tend to continue having trouble communicating and socially interacting with friends and classmates. Behavior issues such as being rigid and having meltdowns continue. In terms of cognitive and academic performance, it depends because children with ASD have a larger distribution of IQ scores compared to the general population, which I'll further discuss later on in the slides. During adolescence, from the ages 12 to 17 years old, typically at this stage, people with ASD struggle with their relationships, social interactions, communicating, and executive functioning, which can cause increases in anxiety and sensory sensitivity. Then, during adulthood, people with ASD tend to struggle in terms of maintaining a job, living independently, and building close relationships. Now moving on to the factors of autism, the first one I want to discuss is childhood IQ. When people think of ASD, they often always connect it to intellectual disability. However, childhood IQ is an important factor in its development and trajectory because it adds to the diversity that is seen within it. ASD, when compared to the norm, has a larger range of intellectual abilities, such as intellectual disability being an IQ of 70 or below, average or above with an IQ of 85, and those that are gifted with an IQ of 130 or above. Higher IQ is said to be linked to less severe ASD symptoms like social and communication or behavioral problems, with favorable outcomes in adulthood. On the other hand, lower IQ is linked to more severe autism symptoms. A lot of times, misdiagnosis can actually happen for patients with higher IQ because they don't display intellectual disabilities. They are overlooked regardless of other symptoms they may have, like problems socializing, for example. The study by Charman et al. 2011 titled IQ in Children with Autism Spectrum Disorders Data from the Special Needs in Autism Project SNAP aimed to examine the distribution of IQ scores in a large sample of children with ASD. Participants included 156 children with ASD from ages 10 to 14 who were part of the Special Needs in Autism project called SNAP in the UK. Children's intellectual abilities were tested using the Wechsler Intelligence Scale for Children. The researchers measured the distribution of full-scale IQ, verbal IQ, and performance IQ. The results showed that there was a wide range of IQ scores. Full-scale scores were anywhere from 40 to 136. 55% of the children had a full-scale score within the average range of 85 to 115. 30% had a score below 70, and 15% had a score above 115. The researchers then concluded that children with ASD have a larger distribution of IQ scores in comparison to the general population. This contradicts the idea that ASD is often tied to intellectual disability only or a majority of the time. The next factor I want to discuss is early language/communication in autism. Like IQ, language and communication skills are important factors in autism because language and communication skills are closely linked to other areas of development, such as social interaction, cognitive abilities, and adaptive functioning. This is why early language and communication can influence the overall developmental trajectory and functioning of people with autism. ASD patients often have a hard time understanding spoken language, using language to communicate, using eye contact, gestures, and facial expressions. Weaker language and communication skills in early childhood were found linked with more severe ASD symptoms like social, behavioral, and restricted interest, and lower cognitive and academic ability. By detecting this early on, patients can attend interventions to help with their communication problems like speech and language therapy. Understanding the abilities and patterns of communication of children with ASD, especially at 2 years old, is important because early communication deficits are often one of the earliest signs of autism. By identifying them, it can help with diagnosis and targeted intervention strategies. This study by Shumway and Weatherby, titled Communicative Acts of Children with Autism Spectrum Disorders in the Second Year of Life, Journal of Speech, Language, and Hearing Research, examined the verbal and nonverbal communication of toddlers with ASD. This study had two groups. Group 1 had 35 toddlers with ASD from the ages of 18 to 24 months, and Group 2 had 35 normally developing toddlers from the ages of 18 to 24 months. The toddlers were observed during semi-structured playtime with their parents. The researchers then recorded any verbal sounds, gestures, and joint attention behavior they saw. Standardized assessments were then used to measure the toddler's communication, language, and intellectual ability. Toddlers with ASD had more deficits in verbal and nonverbal communication when compared to Group 2. Group 1 overall made fewer verbal sounds, gestures, and joint attention behavior. Researchers state that their findings show the deficits in communication and social interaction within ASD. They also state that these findings highlight the importance of targeting these kinds of areas in early intervention programs for young children with ASD. And these are my sources.